Good morning, ladies and gentlemen. Welcome to the first TPD Think Tank Symposium located at the SEED headquarters, King of Prussia. So as Jim said, I actually got into the field in TPD space actually almost 25 years ago. So I solved the first E3 ligase structure, E6AP, in 1999. And with Ning Zheng, actually, we were lab mates at the Memorial Sloan Kettering Cancer Center. So basically, I know Ning for almost 25 years. So it's really a long time in the making for all of us to be here, to celebrate, and also to think for the future. Very importantly, we like this platform to be a more interactive platform and to exchange ideas and also to think about the challenges and opportunities in TPD field and how we can translate the TPD platforms into medicine for patients with unmet medical needs. So that is the goal of this meeting. So first, I want to say that it's an immense pleasure and honor to welcome all of you to come to this event. And I think the audience is just as distinguished as the speakers who are the thought leaders and pioneers in this TPD field. So we'd like all of you to contribute to making this event a successful event. And also going into the future, we're going to have more of this event to come. So secondly, I also want to just give you a little bit background on who are the scientific co-founders of SEED and the chronicle history of the TPD space, how it has become the engine, we can say the engine, the new modality potentially for targeting 80% of the undruggable targets. So as you see from the SEED co-founders, that includes Dr. Hershko, who is the Nobel Prize winner in the TPD space. So basically, his discovery started almost 50 years ago, discovering the E1, E2, E3 ligases, and which are the essential proteins for distributing mediated degradation pathway. He won Nobel Prize in 2004 and really set the stage for drug discovery. But going back in time, so in 1996, actually our co-founder, also scientific leader in the space, Dr. Michele Pagano, actually published paper on cell cycle regulation by TPD, and which was published in Science. And then I was very fortunate to solve the first E3 ligase, E6AP, in 1999, also published in Science. And in 2002, our other scientific co-founder, Dr. Ning Zheng, who solved the ring finger E3 ligase, published in Nature. And afterwards, in 2003, Velcade was approved for multiple myeloma, which is the first proteasome inhibitor. It was also helped by Dr. Hershko to advise them to work on cancer in multiple myeloma. And then in 2004, as you see, Dr. Hershko won Nobel Prize in the TPD space. And in 2007, our co-founder, Dr. Ning Zheng, actually published a seminal paper on auxin's structure, and which is the natural molecular glue in the plant system. And he actually coined the phrase molecular glue. And that was published in Nature. So and then everybody knows in 2014, and there was the revolutionary discovery of the mechanism of Revlimid, right, which is the thalidomide derivative as the molecular glue to glue the Ikaros, the unwanted or mutated protein for degradation by the famous E3 ligase cereblon. So really started the whole TPD discovery space. And that's how the Renaissance came, and that's how everybody is currently using E3 ligases to target undruggable targets. So this is the history, and I think it's a celebration of all the pioneers and scientists here to really try to use the system for unmet medical needs and multiple disease areas. And we also have thought leaders in the afternoon, actually, who are pioneers in the field to teach us, what they are doing in the AI drug design and E3 ligase structure, proteomics, and to look into the future, how we can solve these very challenging problems. So finally, it really takes two to tango, right? So here we have the academic leaders who actually pioneered the field, but we also have the industry people here who are coming from biopharma and also biotech, and from the banks like the analysts and also investors. I think it really takes two to tango to work closely to move the field forward. And in the end, we want to translate high science into medicine for unmet medical needs. So let's make this platform, let's make this a celebration, and let's make this the think tank to continue for the future. Thank you.